Hello, my name is Landon Johnson, and my topic for my informative speech is Crohn's disease. Did you know that approximately 3 million Americans suffer from Crohn's disease, and many of them struggle with debilitating abdominal pain every single day? For these individuals, each day is a battle against an invisible and relentless force. As someone with Crohn's disease, I face this every day. I also understand the importance of others knowing the restrictions that we face to help them greater understand the difficulties of the disease. Understanding the struggles faced by individuals with Crohn's disease, from the physical pain to dietary and social restrictions, is crucial for fostering empathy and advocating for better support systems and treatments. I will first talk about the abdominal pain of people with Crohn's disease and its impact on quality of life, and then transition into dietary and social restrictions of the disease and their impact on life. Chronic abdominal pain, the physical and emotional toll. As someone with Crohn's disease, I know how the pain and not knowing what will come next can affect people and how it makes them feel. Mental health impact of abdominal pain. Tan and colleagues, 2024, say the ongoing struggle with pain and uncertainty can lead to feelings of hopelessness and frustration. As people do not know what's coming next, they might not be able to plan ahead or do anything like that. The role of communication in managing emotional stress. According to Heydrich and Huber, 2025, providing emotional support and addressing concerns related to pain can significantly reduce feelings of isolation and hopelessness. Hopefully, the people with Crohn's disease have a good support system around them that can help them feel better about their disease and about their life. Impact on relationships and social support. According to Tan and others, 2024, and Bogle and others, 2022, Crohn's can lead to withdrawal from activities. Support from loved ones is critical in managing emotional health, and a lack of understanding can contribute to increased emotional distress. Most patients with Crohn's disease just want some understanding, and they might not be able to do the activities they like and love and be able to hang out with their friends because of the uncertainty. Variability and complexity of pain management. Diverse pain experience among patients. Patients all experience different levels of pain. Tan and colleagues state this variation complicates the process of finding an effective treatment and can make it difficult for healthcare providers to develop personalized pain management plans. Everyone with Crohn's disease has a different pain scale, and they all have different symptoms they experience. Challenges in finding effective treatment. While some patients may experience relief with medications like anti-inflammatory drugs, others may not respond, necessitating trial and error approaches. Sindhu and others, 2021, say that this adds to the emotional burden, as patients may feel discouraged when treatments fail to alleviate their pain. There is a need for multidisciplinary pain management. According to Heydrich and Huber, by incorporating different strategies, healthcare providers may provide pain management outcomes and help reduce the emotional toll of the disease. The complexity of managing chronic abdominal pain and Crohn's disease is explained by various factors, including the variability of pain experiences among patients, the psychological burden, and the need for multidisciplinary care. To further explore how this impacts patients' day-to-day lives, we will now look at the dietary and social restrictions that pose significant barriers to daily functioning. Healthcare utilization and social isolation. Increased healthcare utilization. Crohn's requires frequent medical attention. Bogle and others, 2022, state patients may find themselves spending more time in hospitals or clinics than engaging in social activities, contributing to feelings of loneliness. Crohn's patients may spend a lot of time in the hospital or taking medication and not being able to spend time with their friends or do activities they like. Social isolation due to dietary restrictions. DeCastro and colleagues, 2020, say these dietary limitations can make it difficult to participate in social gatherings, leading to feelings of exclusion. Many times, especially with my friends, they spend a lot of time going out to eat when they're hanging out, and for people with Crohn's disease, they might not be able to participate in that because they might not be able to eat the same things as their friends. Lack of understanding. Heydrich and Huber state that this stigma often results in a lack of understanding from peers, further isolating patients. Individuals may feel that others do not appreciate their challenges they face, both physically and socially. Impact on employment and daily responsibilities. The disease's symptoms, including chronic abdominal pain, fatigue, and frequent flare-ups, may have a profound impact on patients' ability to maintain employment and manage everyday responsibilities. I often have to miss school because I'm not feeling well or because of some kind of doctor's appointment I have to go to make sure everything's okay. And I know that many other patients have to deal with the same things, not just at school, but also at work. Being absent and reduced work production. With flaring symptoms and other challenges, patients with Crohn's disease might not be able to be there all the time. They might be absent frequently. Difficulty managing household responsibilities. According to DeCastro and others, 2020, this can lead to reliance on family members for support, which can further strain relationships. They might not be able to hold their own in the house and rely on a lot of other people to do what they need to do. Impact on career progression. With the amount of pain some individuals have, it makes it hard for them to meet expectations. As a result, individuals may face challenges in career growth and are at risk of being overlooked for promotions or job opportunities. In conclusion, chronic abdominal pain and the dietary and social restrictions associated with Crohn's disease profoundly affect everyday aspect of individuals' lives, from physical health to emotional well-being and daily responsibilities. By understanding these challenges, we can foster greater empathy and advocate for improved support for those with Crohn's disease. Crohn's disease affects patients' lives greatly. Understanding what they go through will help them feel more accepted and help healthcare workers take better care of these individuals. Thank you.